According to Cancer Facts, a publication of the American Cancer Society, 1 in 3 Hispanic women will be diagnosed with cancer in their lifetime, being cervical and breast cancer the most commonly diagnosed. What this means is the Hispanic women are twice as likely to get diagnosed with cervical cancer than any other race. And even though genetics and occupational factors could be factors that increase cervical cancer among Hispanic women, we believe that if we provide early cancer detection screenings, we could lower this rate because women who get an early diagnosis are more likely to get a positive outcome, or that is to survive cancer, than women who are diagnosed at a later stage. Why is this important? Well, this is important because Hispanic are the largest and faster growing minority in the United States. According to the Migration Policy Institute, between the years of 1999 and 2015, the immigrant population grew more than 300% in the Kansas City region alone. 70% of all these immigrants live in Jackson, Johnson, and Wyandotte counties. Because our local governments and public health authorities weren't doing much about the rates of cervical and breast cancer in Kansas City, a group of concerned citizens created the Coalition of Hispanic Women Against Cancer back in 2006. This is a nonprofit organization that looks to reduce the burden of cervical and breast cancer among Hispanic women. They do it through education, referral, advocacy, all of these delivered in a cultural sensitive way, and I will tell you a little bit more about it later in my speech. Some of the services provided by the coalition are the mobile pap smears. They do that from the months of March through September, twice every month. They also do referrals because it wouldn't help at all to just tell this woman that they in fact have cancer, but they also need to get treated. They also provide the only Spanish support group in the region, and they also do advocacy. I was able to obtain 2 testimonials for this research, and with their permission, I will tell you their story. Fanny Delgado, she's a cancer survivor. Fanny didn't have insurance, and she had not had the opportunity to have a mammogram performed in years. She also didn't speak any English, so it was difficult for her to get services anywhere else. But one day, she learned about the coalition, and she heard that they, in fact, spoke Spanish. So she decided to get screened. And a couple of days later, they called her to perform further testing, and this helped her to get her diagnosed with breast cancer. And thanks to the coalition, she was referred and she was able to get treated. And now she's cancer free. Now she's a spokesperson for the coalition, and she's paying it forward by telling people that early cancer screenings can save lives. I also have another story. Ana Figueroa. She's currently a cancer patient. Just as Fanny, she didn't want to get screened because she didn't speak any English and because cancer was not part of her plans, so she decided to ignore the symptoms. Some of the cultural beliefs and language barrier prevented her from getting help. Or what cultural beliefs? Well, she thought that cancer was a punishment from God, and since she hadn't done anything wrong, she didn't think she could be diagnosed with cancer. But one day, she also learned about the coalition, gave them a call, got the early screening, and got her diagnosis. Unfortunately, she was diagnosed with stage 4 breast and bone cancer. Her cancer had already metastasized, which means it had traveled from one place and spread out through her body. Now, her chances of survival are only 20%. If she had only seen her cancer a few months before, she will have a much greater chance of survival. She said that she's still fighting this disease, but she wants other people to know how important early screenings are. The role of the local government and the public health authorities in reducing cervical and breast cancer among Hispanic women can be it can be done like this. They have failed to provide services that target the Hispanic population because they have created programs such as Early Detection Works by the Kansas Department of Health and Environment and the Show Me Healthy Woman by the Missouri Department of Health and Senior Services. However, none of these programs help Hispanic women. They don't even have representatives that speak Spanish. And they don't see the factors that prevent Hispanic from getting early detection screenings, such as language barrier, insurance status, and cultural beliefs. The language barrier is an important one because Hispanics that speak little to no English are more likely to live in poverty and less likely to participate in detection screenings due to lack of insurance or lack of understanding. Because of the cultural beliefs, as I already mentioned, and because they believe once a woman is diagnosed with cancer, it's a death sentence. Other women are just embarrassed because they don't want to see a male physician checking their body parts. So some of the recommendations I'll have in order to reduce the burden of cervical cancer among Hispanic women in the Kansas City region would be to create health programs that involve the community and utilize outreach strategies. According to several studies, it report that the involvement of the community is effective in the development, planning, and delivery of screening programs. The use of lay workers, because these are people that already live in the community, so the community already trusts them. We also want physicians' recommendations, because another study suggests that underscreening among Hispanic women is not due to the lack of access. 90% of women have visited a physician in the last year, but 82% said nobody had ever suggested a mammogram. And the use of Spanish media and reading materials. As a conclusion, Kansas City has a growing immigrant population, especially people from Mexico and Latin America. These groups bring with them rich cultures, tradition, and contributions to create a better society. However, they also bring challenges. Some of these challenges are the increasing burden of cervical and breast cancer. And in order to keep a healthy community, we need to take an approach that we also going to involve these people. We're going to create programs, tailor-made programs that focus on bridging the gap and helping this community to obtain better outcomes. We want to promote and educate people about the importance of getting early detection screenings using a cultural sensitive and competent services. If we use programs as the Coalition of Hispanic Women Against Cancer as a model to coordinate efforts and to create new health programs that are oriented toward the Hispanic community, there is no doubt that we could reduce the burden of cervical and breast cancer among Hispanic women in the Kansas City region because this woman could be diagnosed at an earlier stage of cancer and have more chance of survival and recovery than women who are diagnosed at a later state of cancer. Thank you.